The first step to find the PT and OT case mix group is to determine the patient's default primary diagnosis clinical category using the ICD-10 code recorded in item I-20B. To determine the default PDPM clinical category, refer to CMS PDPM ICD-10 mapping tool, which maps a patient's primary diagnosis as recorded in MDS item I-20B to the 10 PDPM primary diagnosis clinical categories. The PDPM mapping tool includes the ICD-10 code, description, the default PDPM clinical category, and did the resident have a major procedure during the prior inpatient stay that impacts the skilled nursing facility care plan. Some ICD-10 codes can map to a different PDPM clinical category from the default PDPM clinical category depending on a patient's prior inpatient procedure history. For these codes, a patient may be categorized into a surgical clinical category if the patient received a surgical procedure during the prior inpatient stay that relates to the primary reason for the Part A skilled nursing facility stay, as indicated by item J2100. If the resident was an inpatient in an acute care hospital for at least 1 day in the 30 days prior to admission to the skilled nursing facility, and the surgery carried some degree of risk to the resident's life or the potential for severe disability, then J2100 equals 1. If J2100 equals 1, and any of the following procedures were performed during the prior inpatient stay, then the patient is categorized into the major joint replacement or spinal surgery clinical category. If none of these procedures was performed, the patient did not receive major joint replacement or spinal surgery during the prior inpatient stay for purposes of determining the PDPM classification. If J2100 equals 1, and if any of the following procedures were performed during the prior inpatient stay, then the patient is categorized into the orthopedic surgery, except major joint replacement or spinal surgery, clinical category. If J2100 equals 1, and any of the following procedures were performed during the prior inpatient stay, then the patient is categorized into the non-orthopedic surgery clinical category. Next, the patient will fall into one of 4 PT and OT clinical categories based on the final PDPM clinical category selected. For our example, patient A has a primary diagnosis ICD-10 code of S34131A entered in item I-20B. Going to the CMS clinical mapping tool, we see S34131A is a complete lesion of the sacrospinal cord initial encounter. The patient's default PDPM clinical category is acute neurologic, and this patient may be eligible for one of the 2 orthopedic surgery categories. For patient A, J2100 is equal to 1, and J2400 is selected as the patient had a spinal surgery involving the spinal cord or major spinal nerves. Patient A qualifies for the major joint replacement or spinal surgery PDPM clinical category. Determine the PT and OT function score based on these 10 section GG items. The PT and OT case mix group is determined using the PT and OT clinical category and the PT and OT function score. Key PT and OT clinical components. CMS provides a PDPM clinical mapping tool to determine the PDPM clinical category based on the primary diagnosis entered in item I-20B. Some ICD-10 codes can map to a different PDPM clinical category from the default PDPM clinical category based on a patient's prior inpatient procedure history. 10 section GG items are used to determine the PT and OT function score. The PT and OT clinical category and function score are used to determine the PT and OT component case mix score.